As dentists, we can fix most dental problems. It's expensive, it's time consuming, and it's not on the top of anybody's list of favorite activities. The best way to avoid unnecessary dental work is to put an emphasis in preventing the possibility of dental work from occurring. It's so much better for a patient to never have dentistry done. And a lot of dentists don't maybe want to admit that. And there can be a tendency for us dentists to think that we can fix anything with our dental drill and it's this magic wand. That only goes so far, and we don't want to do any extra work on you. We just want you to have great teeth that look great, that feel great, and have your teeth for the rest of your life. And so anything that we can do to prevent anything from occurring, or really actively preventing decay from starting, any chance that we can actively prevent dental issues from occurring, will be in such a better situation than trying to catch up to issues that have already happened. Whether it's a dry mouth that to the patient might be uncomfortable, but we're seeing all sorts of dental issues from that, or a patient that may have fallen off the wagon with flossing, or even those that have just a genetic predisposition to having a lot of dental issues. We want to try any solution that's available for us that is evidence-based, that we have seen work in the past in our own practice, and try anything that we can to prevent dental issues from occurring in the first place. At this point, I feel like everybody has heard you go to the dentist every 6 months, and that's just kind of become a part of our vernacular as humans. We have some patients in our office that come in once a year and their teeth look better than some of our patients that come in every 3 months. We have patients that really like getting their teeth cleaned and come in every month just because they like the way that it makes them feel. As long as we're not seeing any major issues, we want to tailor any regular cleanings, recare visits, checkups, x-rays to the patient, because we are all so different and we all have a varying level of risk and predisposition to dental issues. Most common dental problem that we can do our best to avoid is major dental catastrophes, whether it's a root canal. I don't think anybody is signing up to get a root canal unless they're in a lot of pain and it's already too late. We can also check in on teeth that might have the beginnings of decay. Maybe we can find small amount of decay that we could reverse with some preventative, modalities to make that decay disappear. One thing that I don't think a lot of patients think about during their recare visits, we're checking for oral cancer. We're checking for any unusual pathology. And although it's incredibly rare, we have found those types of issues with our patients in our office. And we were the first ones to find it. And if not many people that are looking in your mouth. And so we have a responsibility to our patients to make sure that they're healthy as possible, yes, but also, yes, we have an obligation to our patients to make sure their teeth are healthy and happy. But it can be much more than that when we're talking about cancer, or we're talking about other growths that can happen in the mouth that can really cause a major issue in a patient's life and obviously in their overall systemic health. I've been a dentist for 17 years. One of the things I've anecdotally seen, particularly when it involves couples, is there's always one person in the relationship that never does what they're supposed to do, never flosses, randomly makes dental appointments, and has zero dental issues. And then you have the person that is on top of it, makes their appointments, tries so hard, and always seems to be struggling with some dental issue. And this person doesn't understand what it's like for this person, and is this person has no idea what it's like not to constantly worry about their teeth. We all have different risk factors. We all have different dental past and dental history. We want to look at the current state of the dentition, and we want to look too, does this patient have a lot of old restorations that are 20, 30 years old, or does this patient have 10 brand new cavities that have been filled? And we would approach those two patients maybe differently. Sometimes we are battling a bacterial issue, a genetic issue, sometimes even a mental health issue. There's all these different variables that we have to really assess the entire patient and kind of meet them where they are and figure out what we can do and how we can do that. And there's plenty of places that will offer a very cookie cutter assembly line type of approach to dental care. And aside from that not being fun, this doesn't feel good to us. We don't want to come up with a routine system that sort of takes the uniqueness of each patient out of the equation. So I think that home care is probably the most important aspect of maintaining your smile. You have to know how to do that, number one, and then you have to actually do it. Number two, we may see a patient twice a year, but then there's 363 other days that we don't see the patient. And so imparting knowledge, our expertise, and educating our patients on the best practices that they can be doing, we can ensure that our patients have the smile that they want for as long as they want it. I think everyone has a little bit of dental anxiety. You're upside down. We have this person that's a foot away from your face with a mask, and all you see are these two beady eyes looking down at you. That's not comfortable. It's a very vulnerable feeling. And then you have a brain that's attached to this patient that might be telling it to increase our heart rate. Let's start sweating. And the example I always give is I'm the guy that passes out when I get my blood drawn. I don't want to pass out, but my body betrays me. It's not a matter of mind over matter. It's just your body just has this response. How do we help in that process? Whenever a patient is nervous, there's no sense in trying to hide that they're nervous. That's okay. I like to think I'm funny, and so I'll joke around. Patients think I'm way funnier when they're on laughing gas, but that's another thing that we really do a lot with patients that may have a little bit of anxiety about coming into a dental office. You can give us a call or you can email us, and we'd love to get to know you better.